Welcome to CareTalk, America's home for incisive debate about healthcare, business, and politics. I'm John Driscoll, the chair of the Yukon Health System. We're in the middle of March Madness, so please, everyone should be supporting Yukon. And today, for CareTalk, we are talking to Spencer Pratt, the Chief Growth Officer at a company called Nourished RX. Welcome, Spencer.
Thank you for having me, John. Excited for the conversation.
I think we couldn't be talking to you at a more interesting point. Can you talk a little bit about what Nourished RX is?
Absolutely, John. So Nourished RX is a digital health and tech-enabled services companies that operates in what we call the food is health space. And so what that means is we run programs on behalf of healthcare organizations that address the number one root cause for chronic disease and healthcare cost, which is diet and what we put into our body. So we partner with healthcare organizations and government agencies across the country to deliver scalable programs that convert diet and nutrition from a problem, which it largely is in our country today, into a solution that drives better health and lower cost for our partners that we're working with.
As a practical matter, though, Spencer, I mean, everyone knows diet's a problem. Why do you think it's mutable? How? I mean, we've been living with an America that is, from a military perspective, and many of the recruits are too fat to fight. We've got an exploding diabetes problem. We've got a cardiometabolic problem that's growing. That's that the GLP-1s, I mean, are struggling to make a dent in, although we're quite optimistic about that. What makes you think that diet is changeable for Americans?
I think we're seeing growing recognition, John, that diet is the number one root cause dynamic that we should be focused on as a country to improve health and improve health in a sustainable way. We're seeing growing momentum with policymakers. We're seeing growing investment from healthcare organizations into the number one, what we think about as modifiable driver of cost and poor health. And we see that in our programs across the country, John. We have 2/3 of participants coming into our programs that report to us when they come in that their diet is harming their health. So there's that growing recognition from the public and from consumers. I understand that what I'm eating is hurting my health, but 95% of people are motivated to make changes to take control of their health through diet and lifestyle. What we've been lacking in this country is the support and momentum from policy and healthcare funders and organizations like Nourished RX coming up with a structure and the framework that really makes behavior change possible.
Just to be clear, you're saying that people, I mean, we know that diet is a massive problem just based on the BMI exploding and the growth of diabetes and how the problems of cardiometabolic disease, which used to be a problem of the elderly, are now touching almost every demographic, including kids. You're saying that individual consumers understand that and want to change?
We are seeing growing recognition of that across our country. Public perception and consumer interest in nutrition is growing at a significant rate. We see over 80% of consumers in this country, John, that report that they want food and nutrition more deeply integrated into their healthcare. Nutrition is a foreign concept for a lot of people historically, and I think a lot of folks have not really understood what they should be consuming, how it connects to their health, how do they get started. And with policy and this public perception and solutions like Nourished RX converging at this moment, we're in a real moment where this change is possible.
How did you get to Nourished RX? What's your healthcare journey that got you to join the Nourished RX team and now lead it?
I've focused my entire career, John, in healthcare, always focused on building solutions that address upstream drivers of health. And so you hear about the term social determinants of health, everything happening outside of the four walls of healthcare with respect to where you live, who you live with, how you engage in your community, who you engage with in your community. All of those dynamics are much more influential and predictive of what's going to happen to your health than the 2 doctor visits that you have in a given year and what happens in the setting of the four walls of healthcare. And so my entire career has been focused on understanding those upstream drivers of health and building solutions that really address them in a meaningful way that can change the trajectory of health in our country. And at the top of that list, John, is food and diet. And for a variety of reasons, have gotten very, very motivated and passionate around solving this problem. Or we think about it as an opportunity to really change the trajectory of health in our country through something as fundamental as what we eat.
So maybe break down exactly what Nourished RX does. I mean, like everything else in healthcare, I'm sure it's complicated, but how do patients find you? How does the chronically ill patients find you? And then what happens? What's the process by which a person finds Nourished RX, gets access to care, and kind of what are the results?
So health plans, health payers, as well as government agencies are motivated to improve health and lower cost. And they're out there every day looking for solutions that can help them do that. Nourished RX is a solution that engages people, it improves health outcomes, and lowers costs. And so a lot of the work that we're doing, John, is in partnership with health plans, with government agencies that are looking to offer really, really compelling, comprehensive health management behavior change programs that can help them do those things.
So a
And
health plan hires you.
a health plan hires Nourished RX. We understand what their number one needs are. So let's say, for example, we're really focused on improving diabetes outcomes and healthcare costs related to diabetes. We will contract with a health plan. They will send us eligibility files of members that they manage in their population that they want to engage in the Nourished RX program. We then run marketing campaigns to drive awareness and promote the program available to those members. We get them into the program, and we run our program from there, delivering clinically guided food, telehealth nutrition counseling and health coaching, digital education, things like meal planning and recipes, and personalized tips and nudges that help people stay on the right track. And then we report the impacts that we're having for those members in our programs on behalf of the health plan.
For folks who have diabetes, I mean, a low sugar or a vegan diet, like people, to your point, know that this is a problem. Individuals have known it as a problem forever. What makes you think or show that you can actually change people's diet and change the way they consume the food that's killing them?
I think one thing that's different about our approach, John, is historically you'd go to the doctor and the doctor would say, you need to eat better and here's a brochure, go eat these foods. And most people wouldn't know where to start, or they wouldn't have trust in that process because they haven't felt the impacts of eating that way historically. So what we're doing is we're actually delivering the clinically guided food that's guided by the dietitian working with the member. That food shows up at the participant's home and they start consuming it. And within a week or two, we're driving an aha moment where the member says, wow, I feel better. I have more energy. I trust the food that's being provided to me, and I trust this program, and I'm motivated to continue because I haven't felt this way in a long, long time. And so through experiential learning and delivering a tangible good, like this clinically tailored food that we're providing, it builds that aha moment and opens the door to meaningful engagement throughout the program.
And so you give food, you're guiding with a tech-enabled service. What are the results like?
First and foremost, activation, engagement, member experience results are gold standard in the industry. We're seeing incredible rates of engagement, incredible member experience, and that's foundational to building trust and opening the door to clinical impact. From a clinical impact perspective, we have so many great results, John, but I'll share just one or two examples. Within diabetes programs, we're seeing a 1.5 point reduction in HbA1c within 3 to 4 months. That's the key measure that we're looking to improve for members living with type 2 diabetes. And for reference, that's more effective than most diabetes medications. And I think even more compelling, John, we talk about sustainable behavior change often. Our goal is not to deliver food to members like we do with medications for a lifetime. It's to use food as an activation tool and an engagement tool that drives immediate nourishment. But really, through that, as well as the coaching and the education, we're driving confidence and knowledge and new skills and habits that can last a lifetime. And as we follow members up to 12 months post receiving the food from Nourished RX, not only are we seeing maintenance in that A1C reduction that we see in the first 3 to 4 months, we're seeing continual improvement in A1C to a 2.2 point reduction on average 12 months post starting the program.
Do your programs go a lifetime the way drugs do? I mean, how does that work?
Our goal is not to deliver food for a lifetime. I know there's a lot of conversation in policy, John, around food being viewed as a social benefit or an entitlement. That's not how we think about it. We think about our programs as a time limited intervention where food is used as a clinical therapeutic in that first 3 to 4 month period to drive that experiential learning, drive the immediate clinical impact. And then we transition members into a self-maintenance phase of our programs where we want to keep them engaged, but not with the intensive coaching, the intensive food delivery. It's more of a digital maintenance phase. And our goal is to keep members engaged digitally for life to help them continue to practice what they learned during the intensive part of the program.
But that's a lot lower cost for the health plans if you go from food delivery to then just digital delivery of messaging.
It's a lot lower cost. It is applicable to everybody in our country, not just the individuals living with high risk cardiometabolic disease, but there's significant opportunity around prevention and general wellness through a digital forward solution. But what's really exciting is as we think about the digital engagement self-maintenance phase that really carries members into lifelong impact, that's very well aligned with new models coming out from the administration, like the access model, which is a technology forward chronic condition management type of solution. And so what we're doing today with government agencies and health plan partners with our core cardiometabolic health programming is very applicable to some of these new CMMI models like Access.
And just maybe give folks a context for what these, well, first of all, I think no one will be surprised that the Make America Healthy Again agenda is very focused on food. So that's got to be an incredible change of the frame for how people think about healthcare. But maybe talk a little bit about, because it's not just Access. There's a number of programs that the Center for Medicare and Medicaid is putting out to engage folks digitally in the categories that would include Nourished RX and food, targeted food interventions, even though it's at a digital layer. Maybe you could talk a little bit about what all the new funding streams might mean for you and companies in your space.
Yeah, we since Nourished RX was founded in 2019, John, we've been fighting the battle. We've been in the trenches, contracting with health plans. As you know, it's not easy to contract with health plans. We've built a lot of credibility in that space. We're doing great work with health plans across the country and have grown pretty significantly over that time period. And we're viewing a lot of these new models from the administration as really an amplifying dynamic for us, where the opportunity that we have to scale what we've done with health plans over the past 6 years is now magnified significantly. So we have the access model, which is digital first chronic condition management for original Medicare beneficiaries. We have the ACO lead model that's going to be in effect starting 1/1/2027, which is the next. It's the next evolution of the ACO reach model. Driving a value-based framework for original Medicare through ACOs with financial incentives aligned kind of long-term to support investment in root cause and upstream drivers of health. And very excitingly, food is emphasized there. There's expanded offerings for food support as well as expanded medical nutrition therapy support under that ACO lead model. We have the Make America Healthy Again Elevate model, MAHA Elevate, which is $100 million of funding that's going to be going into nutrition and lifestyle-based solutions to test the efficacy of services that are not currently covered by original Medicare to demonstrate improvement in cardiometabolic health outcomes. And then you also have the balance model, which is focused on nutrition and lifestyle support as a companion to GLP-1 therapy. So across all four of those models, they're different. There's different application for companies like Nourished RX, but they're all pointing to nutrition.
Real money coming from the feds to actually invest in food. I mean, I don't think I've ever heard of this many different models being dropped at nearly the same time. And secondly, I think this is the first time I've ever heard the feds think about funding nutrition and food related programs. Is that right?
That's right. With this level of emphasis and being this deliberate about the intention to focus on nutrition and focus on food support as part of chronic disease management, and really spanning from prevention all the way to management and reversal of cardiometabolic disease. This is as intentional as we've seen the federal government be around food nutrition.
Okay, so you've been at this for more than a few years now, 6 or 7 years now. What are the results with the health plans? I mean, have you? What are the lessons learned, and what are the results that you can apply to these new funding, these new opportunities and funding models?
Lessons learned, we talked a little bit about really strong engagement leading to improvement in self-reported health outcomes, improvement in clinical outcomes. But when the rubber meets the road, John, we need to demonstrate financial viability, and we're impacting affordability. We're driving medical and pharmacy cost savings. And across our programs across the country, many in Medicare, some in Medicaid and commercial, we're seeing significant reduction in medical and pharmacy costs. One example, $474 of medical cost savings per member per month in a congestive heart failure
That's
program.
massive.
Massive, driving massive return on investment for the health plan. And again, it's not an ongoing medication that you're paying for into perpetuity. You're making an investment in a program that is addressing root cause issues and driving sustainable behavior change. And so that impact in the first 12 months is going to continue to materialize as we look into subsequent years. So those are the learnings as we think about the continuum engagement, clinical impact, medical cost savings that we're bringing to these new CMS models, and really focused on affordability given the crisis that we're in. And we can't solve for that crisis until we go upstream and address the number one driver, which is diet.
But it feels like you're meeting the moment in terms of we know that nutrition's a problem. You've got positive results. The funding is coming. It's got to be an interesting time to be building in this space as the financials are changing. What are the biggest challenges over the next 12 to 24 months for Nourished RX?
We think about nutrition as the connective tissue, John, to physical, mental, social, emotional health and well-being. There is no shortage of opportunity to apply our food as health model to solve for a myriad of challenges that are plaguing our country today. So one thing that we're continuing to focus on is like, stay focused. Let's stay focused on the areas that can create the greatest impact for the business and for our country as a whole. We talked about some of those examples of cardiometabolic health programming, the new CMMI models. We're doing a lot of work around maternal health, as well as leveraging our technology platform to help other organizations scale their own programming. So we're staying as focused as we can be to ensure that we're driving the level of impact for Nourished RX and for the country as we can. And then I think second is just there, because of all this opportunity, because of all these new models that have come out over the past 6 months, the need to move quickly is really important. So we're moving quickly from a market engagement and go-to-market perspective, moving quickly from a product development perspective to capture some new opportunities in the market. And we just want to continue to move as quickly as we can to drive this impact.
How does AI play into this? Is it a positive, a negative, neutral? I mean, it just feels like it's an overlay for any digital health company. How important and relevant is AI to the Nourished RX journey?
It is, it's critical, John. At this moment, AI is critical. It's a core part of our strategy going forward, in terms of how we operate as an organization, in terms of how we deliver clinical care through our team of dietitians and health coaches, in terms of the member experience within our program, ensuring that it's personalized and members feel supported throughout the entire journey, with human impact that we'll maintain, but also asynchronously through AI tools. And one thing that's really exciting, John, is we've spent the last 6 years running these programs, collecting data from a diverse set of stakeholders, the health plan, the participant in the program, our food supplier partners, our care team, where we're generating data. We have a really rich data set over 6 years, longitudinal engagement pathways with our participants. And that is really going to be underpinning and underlying our entire AI development efforts and strategy. And we believe that we're in a really unique position with that data set that we have access to.
So maybe a last question, Spencer. What, if you look out 10 years, what role do you think NourishedRx can play in a different world where perhaps food and nutrition are integrated into a healthcare system?
We so connecting the food industry and healthcare is big, right? The two biggest industries that we have in our country. And that's effectively the work that we've done over the past 6 years, John, bridging food systems and healthcare systems to deliver a model that aligns incentives and is cohesive and integrated. And so looking 10 years out, our vision is we want to be supporting and enabling that model at scale across our country. We have the network of suppliers that are delivering clinically tailored food. We have the technology platform. We have the operational blueprint for how this works. And we're going to continue to invest in making this model scalable for all stakeholders that are delivering healthcare and related services across the country.
Awesome. Well, thank you, Spencer. And if you like what you heard or you didn't, we'd love you to subscribe on your favorite service.